Good evening, everyone. Thank you. Let us know in the chat where you're coming from. I see we have places from all over the United States. We have NAMI DeKalb, Georgia. We have NAMI affiliates from all over New York State. Welcome. Thank you for joining us. And so I think we have a core contingency now in the room. First, let us introduce ourselves. So my name is Kimberly Blair. I'm the Director of Public Policy and Advocacy here at NAMI-NYC. And I am so enthused and happy to welcome our two panelists, Denise Balzer from the Office of Mental Health and Kelly Clark from NYC Well, as well as Vibrant Emotional Health. And so the topic of today is really the new nationwide 988 mental health crisis number, which launches this Saturday, July 16th. It has been a long journey to get here since 2020 when the federal mandate came in. And we really are excited to talk to you about how this is going to look in your communities, specifically in New York City. So first, I would like to just give the floor to Denise Balzer to tell us a little bit about herself.
Hi, good evening, everyone, and thank you so much for having me today to talk about 988. We've been very excited about this opportunity and the launch, and we've been preparing for quite some time. So I'm the Director of Crisis Services at the New York State Office of Mental Health. About a year and a half ago, we received a grant from Vibrant Emotional Health and SAMHSA to create an implementation plan for 988, and we assembled a stakeholder group of more than 150 people, and it continues to grow because it's continuing through implementation to inform this implementation plan. And this stakeholder group did a fantastic job identifying the steps that we needed to take in order to get to this point. And we're very excited for this to happen. So our group included state agencies, advocacy groups, law enforcement, directors of community services, individuals who represented special populations, law enforcement, and a number of other folks. So we are grateful to them for this opportunity and this launch as of Saturday.
Thank you so much, Denise, and thank you for that overview. And then we're now going to introduce to you Kelly Clark. Kelly?
Hey, good afternoon or good evening, everyone. So as mentioned, my name is Kelly Clark. I am the Program Director for NYC Well at Vibrant Emotional Health. And we have been an answering point for Lifeline contacts since 2005. We are one of now 200 different network centres that help to answer the Lifeline. So we've been closely watching along for all of the work that has gone into making 988 happen. And as Denise mentioned, there has been the statewide implementation coalition. So we've been working closely with the city and the state as we really all get prepared and ready for this big and important weekend that's coming up.
Thank you so much, Kelly. I'm so excited to have both of you on here. So let's just jump right in. I know many folks are wondering, what is the history behind 988? How did we get here, right? And many folks don't know that this is actually a federal mandate. So I guess my first question is to Denise. So Denise, you discussed some about your office's role in the development of 988. Could you just speak a little bit about the history of how we got here, the legislation, and why it's important to have this new crisis number today?
So the National Suicide Hotline Designation Act was brought into law in 2020. And this designated 988 as the 3-digit dialing code for the National Suicide Prevention Lifeline. Prior to that, there was many years of activism in order for this to, come to fruition. So it didn't happen overnight. There was much advocacy, there was much activism, and it was finally signed into law in 2020. And that's when all of the activities began around funding, implementation, planning. And for New York State, we think it's important because we've been working for many years on developing a comprehensive crisis response system. It began with some reimbursement for crisis services through Medicaid. And then this 988 implementation gave us the ability to really put our vision into action. So through 988 being a single point of access or a point of access for individuals who are experiencing a behavioral health crisis in order to connect with services was something that we were looking for a way to fund, a way to implement, and this gave us the opportunity to, and I think across the nation, gave us all the opportunity to move forward with this comprehensive crisis response system planning. And for New York, it's not just a mental health crisis line for us, it's a behavioral health crisis line, because we want individuals who are experiencing mental health symptoms or need help, as well as substance use symptoms as well, or some substance abuse symptoms, to be able to access this line and get support and help.
Thank you so much. Thank you for that overview. And you know, as a quick follow-up question, a lot of folks are actually, whenever I talk about 988 and I do some advocacy work, they always ask me, why does this number need to be separated from 911? Could you speak a little bit to that?
Sure, they're very separate services. So 911 is an emergency dispatch system. If you call 911, it's because you want a response immediately. And 911 is connected to law enforcement, fire, and EMS. So that's 911's purpose, emergency. 988 provides a broad range of services. You're connected to a trained counselor in order to talk through any distress or needs or worries or beyond that. So it provides a service right up front. And then with that conversation, with that opportunity to speak with a trained crisis counselor, together you can determine what your next steps will be.
Thank you. Thank you so much for that elaboration. And so Denise just spoke to the history of how we got here and the need for 988, you know, the need for separate services to address mental health crisis response. My next question is for Kelly from NYC Well. I know that NYC Well has been actually addressing mental health crises calls for some time now, right? And some folks on this call may or may not be familiar with what you all do. So come this Saturday, July 16th, you all will be operating the new call center to take these 988 calls for New Yorkers in the 5 boroughs. Could you just expand a little bit on, you know, on that and who can call 988? Like who should call?
Yeah, definitely. So as I mentioned at the top, the Lifeline network is actually made up of over 200 different contact centers. And so we are one of those. But I think one of the things that Denise touched on earlier that's also really important is when we're thinking about this new service or the expansion of this service, right? Because this is building on the National Suicide Prevention Lifeline. That expansion is to beyond just a suicide line. And we see that reflected also in the name change that's going to happen as well. So it becomes the 988 Suicide and Crisis Helpline. So that's talking much more around, you can still reach out if you are struggling with thoughts of suicide, but also mental health or substance use or any kind of situation that you find yourself in emotional distress. So that could be things like being worried about your financial situation. It could be a relationship breakup. It could be illness, it could be loneliness, it could be a range of things. But it also means that you don't have to reach out for yourself. You can reach out for a loved one. So if there's someone in your family or if there is a friend that you're concerned about who's experiencing any of these, then you can also reach out to try and get support for both yourself and that individual. And I think it's really important to acknowledge that, you know, you would reach out because you're getting that connection to an individual who is able to offer compassion, empathy, and support, and really be able to work with you around what are the best way to meet your needs at the moment. And there are times where that may not be around a 911 response. That may be more around what can happen in that moment when you're engaging with a trained counsellor who's listening to you and helping to get a good understanding of what your concerns are and what might be the best things that could help you to, alleviate some of those concerns, or what might be the best supports and connections to care that you can receive.
Thank you so much for that explanation and elaboration. And I actually heard you say something that I think is really important to note. NYC Well, you can access it not only through 988 by calling, but you can also access via text. And if you go onto the website, there's a chat box, correct?
Yeah, so both NYC Well and 988 are accessible through all three modes of contact. So by calls, chats, and texts.
Thank you so much. And so I don't know if you all know a little bit about the history behind NAMI-NYC, but we really do support peers and family members and friends and other loved ones and caregivers of people with mental health conditions. That's our model. We believe that by supporting everyone around the individual, we can help lead to better outcomes. So it's really cool to hear that even family members can access this line and see how best they can support their friend or family member who is maybe in crisis or in need of extra help. As a peer myself, I know oftentimes the fear that comes with a family member dialing 911. So it's really cool to have this 988 alternative so that we can try to change certain outcomes. So can someone just elaborate? I guess this is the question for Kelly. Since you are part of NYC Well, and NYC Well is going to be now leading the charge on taking these 988 calls, can you just walk me through the process, right? I'm a peer, I need help, I need support, I'm now dialing 988. What happens?
Yeah, so when you call 988, some of the first things that you'll hear is a greeting, and you'll hear some options that helps best determine the way that your call will be routed to meet your needs. So one of the things that you'll hear is an option for Spanish-speaking individuals to connect with the Spanish Lifeline subnetwork. The other option that you'll hear is about whether or not you're calling around a military veteran or you identify as a military veteran, and then you can get connected and routed through to the Veterans Crisis Line. If you're not selecting either of those, the system then routes you to the local contact centre based off your area code, and there a trained counsellor will answer your call. They will talk to you to get an understanding in terms of what has prompted you to reach out at the moment, what's going on that they can help to support you with. And they'll provide that support, some of that de-escalation. They might help you to identify some coping strategies that you've been able to use successfully previously when you've had this type of situation that's come up, might help you to identify some new coping strategies. They can do some assessments with you to help you identify what could be the best intervention, and are there resources that we could connect you with that might be beneficial for you. And that may include, NAMI, if we're talking with an individual who is a caregiver or someone who is a third party, an individual who's looking for other resources and community to connect with. It might include other types of resources such as mobile crisis teams and such. So we're really working with the person to get an understanding in terms of what's going on at the moment and what do they need in that moment to best support them.
Yeah, thank you. That's very helpful. And it's very helpful to know that there's follow-up resources in the community. What does follow-up look like? Is there some follow-up maybe the day later or something depending on the call?
Yeah, so there's a range of different things that can happen. If we have highlighted some resources for you that we think might be helpful in your situation, we can do a warm transfer for you whilst you're on the call with us. So we might be able to connect you directly to that service so that your one phone call is getting you that little bit further in terms of where your connection might be. We can also, if we've identified a number of resources, but you're not ready to connect with them at the moment, or perhaps those services are closed, you might be calling us in the middle of the night and those services are closed. We'll provide you with all of the information that you need to make contact with them, and we can email that information to you so that you have it on hand as well, if that's helpful for you. And if during the conversation that you've had with the counsellor, there are some concerns about your safety or risk that might be identified and such, you can consent into follow-up, which means that one of our counsellors will give you a call anywhere between 24 and 48 hours to check back in with you and see how you're doing. Maybe you've tried to reach out to some of those referrals that we provided and those resources to connect with. We want to check in and see how that went. How are you feeling today compared to how you were yesterday? Has the situation changed? Are there other ways that we could be helpful for you in the moment?
Thank you so much for that overview. And we're going to take 2 seconds to address a technical difficulty that I'm seeing in the chat. So if everybody switches to gallery view, you'll be able to see all 4 boxes, not just the ASL interpreter, as well as if you switch to the English channel, then you should be able to hear English only. I think some folks might be in the Spanish channel. Okay, resuming onto our programming. I guess this question is for Denise. So thank you so much, Kelly, for laying out that process for people in New York City dialing into 988. I think that's the whole point of why we're here today. We want to demystify this process for people. We want people to know that how they can access help and what is the response that might happen, right? But Denise, since you're familiar with the implementation at the state level, is there actually any pertinent information our audience members should know about dialing 988 if they leave the 5 boroughs to visit other parts of New York?
Well, I think Kelly touched on that, is that calls are routed through 988 by area code. So if you have a New York City area code and you call 988, it will be routed to the New York City call center. So it'll be routed to NYC Well or Vibrant and NYC Well. What can happen is that if you're in a community where you need help there, you can speak with that counselor and talk to them and tell them where you are, and they can connect to a local crisis line in that region or area. But initially, like Kelly said, was that, someone wants to make sure you're okay, make sure that you're not in, you don't have an emergency or not at high risk of harming yourself. And that we would want to make sure that you got connected to the services closest to you, and they can help with that no matter where you are. And that if you wanted resources closer after that process, you would be connected to a local line if you choose. Sometimes folks just want to talk. There's something they want to talk about, and it doesn't matter who they connect with or where they connect, that person can be helpful to them.
Sounds good. Sounds so good. Thank you for parsing that out and, just making sure that New Yorkers know that they're covered no matter where they go. And I just also want to add in that since this is a nationwide number, if any of you are to leave New York City or New York State, you can also dial 988 when you're in crisis. And you should be able to tell folks where you're at when they pick up the phone to be able to best access care. Denise, did you want to add something to that?
Kelly might want to say too, if you're from outside of New York City and you're in New York City and you want to access help in New York City, you can call NYC Well directly.
Absolutely, that would be our recommendation because of the way that the routing works. And we know that New York City is a city full of lots of people who have traveled to live in the city, who might have come from different areas and so perhaps come with different phone number area codes. But if you are here in the city and you're looking to connect with local resources, that might be the instance where you call NYC Well's phone number directly, which is 888 NYC Well. rather than calling 988, because you may connect to the center that's closest to the area code associated with your phone number.
Thank you so much. But oh, go ahead, Denise. Yes.
And also that there's a national conversation going on about the use of area codes versus geolocation. So that conversation is happening on a federal level about, ways to move forward, and they've gotten public comment and heard from individuals about making that switch. There's been no determinations made about moving forward, but just so people know that conversation is happening, and states can't change that routing, even though they may want to. They might want geolocation. States don't have any control over how calls are routed. It's through the National Suicide Prevention Lifeline.
That's really good to know. This is really good information, because obviously, we want folks to be able to access care in the most efficient way and expedited way possible when there is a crisis. So I do appreciate you all going into that. I just want to clarify based off of what you're saying, so that everyone's clear. So say someone doesn't know and they're visiting New York City from out of town, or their area code, I have an out-of-state area code actually. So if their area code is different and they do call 988, you're saying there might not be a way to route back to NYC Well if the call center routes you to that out-of-state number or call center?
Yeah, so the routing will route you to the contact center that is closest to the area code that you are calling from. You can, if you are looking to connect with resources in New York City and you didn't realize that was what was going to happen and such, and you connect with, I think we have some folks from South Dakota on, so let's say you connect with a center in South Dakota. Those counselors there are going to do the same work that we would do in terms of checking in with you, making sure that you are safe, getting an understanding of what's happening. And if you identify that you're actually calling from New York City and you want to connect with resources in the city, they can look to make a transfer through to NYC Well so that they can connect you. And then we can talk about what might be services in the city that would work best.
Perfect. Thank you again for just re-clarifying there. And so throughout I guess this is a question for either panelist, because both of you are really steeped into this work. So throughout our advocacy efforts here at NAMI-NYC, we have actually heard many concerns from our members and other coalition members as well about the lack of advertising of the new 988 number. Are there any initiatives that either of you know of, maybe Denise at the state level or Kelly at the city level, that you're aware of to promote community awareness of the new number moving forward?
Yes, we've had lots of conversations about this. Nationally, through SAMHSA and through the states, is that we are considering this first year or so like a soft launch. And that means we're trying to communicate through these types of forums. What is 988? Who uses it? How can you use it? How do you access it? What services are available? In order for us to help the 988 crisis contact centers build capacity for increased volume. So what we would not want to happen is through a big marketing campaign and education where people are calling and then they don't get what they need because the volume is too high. Not that their calls wouldn't be answered, but it may not be as efficient as giving us additional time to build capacity, because this is a large, it's a big endeavor, because it's not just about creating a volume or capacity in the call centers. It's about making sure that the system can support as well, so that there are mobile crisis services in communities, that there are crisis residential programs, that there's opportunities for people to connect and get treatment supports if they want them, or social supports. So we're also simultaneously to all of this trying to build community capacity for the response after 988. So we want to be able to take this slowly in a way that we're being very thoughtful and mindful about how it's rolled out, and don't want to get ahead of ourselves, because we want people to be safe and we want people to have the resources that they deserve when they call.
Thank you so much. Thank you for that explanation. Kelly, is there anything you'd like to add to that? Or, okay, awesome, awesome. And then so I think that a lot of folks, and I'm seeing some of this in the chat, you know, some folks want to know about mobile crisis teams and how they interact with this response model. I know that, Kelly, you touched upon a little bit on there are different avenues when you call in on what the response might be, but could you speak a little bit to, you know, what are mobile crisis teams and how will they interact with your office and the new 988 number?
Yeah, I certainly can. So mobile crisis teams are an existing service in the community that have really strong ties with NYC Well in particular. So NYC Well is the single point of access for mobile crisis, which means that if you're wanting to make a mobile crisis referral for anyone who is located in the city, that you need to make that referral through NYC Well. Now, NYC Well will help to determine whether or not the individual that you are concerned about, or if you are the individual, is eligible for a mobile crisis referral. And so that includes that you may be, or the individual may be at risk of a psychiatric crisis and may be unwilling or unable to get the supports that they need in that moment. And mobile crisis teams will go out into the community. They're usually staffed with clinicians and peers, and do the assessment with the individual in their home or a place in the community in which they're able to engage. That really then doesn't necessitate necessarily that person turning up to the emergency department. It also helps to divert 911 calls that might have resulted in a EMS call out where EMS is then transporting the person to hospital, and helps to try and keep the person in the community so that they're able to access their existing support networks and to help them to achieve some of that stability in the community. Now, NYC Well's role in that is also that if the person who is reaching out about their loved one, perhaps we determine that that loved one is not eligible for a mobile crisis referral, we're still able to provide other supports and services. So that phone call still helps to connect with support services, even if that may not be mobile crisis. And we certainly know that lots of family members and loved ones reach out not knowing about mobile crisis and not knowing that it's potentially an option that's available. So we can listen to what's going on, and we can help to provide a little bit of psychoeducation and information about, well, this sounds like it could be a mobile crisis referral. Can I talk to you a little bit about that and what that might look like for you and your family or the loved one? Now, because 988 is connecting through to NYC Well for New York City, we're going to have the same capacity to be able to do that for any call that comes through to us on 988 also. So we'll be making sure to make those connections. The one thing I would say is to any provider who is located here in the city who is attending, they should make those provider referrals still through NYC Well. That's the best way for those referrals to come through to us.
Thank you so much for that overview. So would you actually suggest for providers, you're saying that providers should still contact through NYC Well, and I know that on your website you have a whole providers tab, like there's resources. I know there are providers on the call, and that's why I'm making sure that all bases are covered here today, right? So is there, say a provider doesn't know that they can access via the website, or they haven't watched this video. By the way, if you're a provider, share with your friends. But say they don't know, if they dial 988, can they also still access services for their patients?
Yeah, they're still going to be able to access services for their patients. I think, as we were highlighting before, one of the things that's a nuance to 988 is going to be that routing piece. So if the provider doesn't have a phone number that has a New York City area code, they're not going to connect with NYC Well. So they might be some of the instances where it's just better to call NYC Well directly to make sure that you're connecting in the area in which you're wanting to make that referral for your client or patient.
Thank you so much. Thank you so much. And so I'm going to just end with one question, and then we're going to open it up to, the chat is booming. We have a lot of Q&A in the chat. So my final question for you is the following, and it's for both of you. 1 in 5 New Yorkers live with a mental health condition. And we know that this 988 is not the one-stop quick fix solution to all mental health crises across New York. In fact, sorry, my dog wants to advocate. We know that it's a start. It's just a start. So based on your professional lived experience, what is your ultimate vision for the next steps that need to take place in order to truly address the crisis here in New York? I'm going to begin with Denise, because you have a higher level statewide approach in your work. And so if you really, had a vision as Denise Balzer in your own capacity for how we could really move forward to address this issue, what would it be?
Well, I think, for me as an individual, me as in my position and, working for the state and advocating for mental health resources is the collaboration between agencies, I think, and continued collaboration. So that means all of us talking to each other, all of us understanding what we currently do now, and being able to work together around making sure that no matter where someone makes contact with the system, that they get to the right place. So that is I think we are taking steps in that direction, which is one of the benefits of 988. It's really opened the doors for people to be able to talk to each other across systems that never did before. So I think for us, it's that collaboration, continued conversation, coordination that never ends. Because we also talked about sometimes you introduce something and then you think everyone knows about it, and then it goes away, right? It doesn't continue to progress. So for us, it's continued collaboration, continued conversation, continued coordination over time.
And then thank you so much for that overview. And then now I'm going to ask Kelly the same question. Kelly?
Yeah, I think I would echo a lot of what Denise is saying. I think this is definitely the first step. Having a 3-digit number that is so much more easy to remember than a 10-digit number really does help to improve the accessibility to services. But we also want to make sure that we have those additional services behind the crisis lines to be able to continue to support people who may need some additional support, who may need different interventions, who need something a little bit longer term than what the crisis line is going to be able to do. And I think that this really provides us with a unique opportunity to start to build out a really coordinated crisis continuum that's able to serve people in a way that is best meeting their needs in environments that best meet their needs as well, and that moves it away from a law enforcement response.
Thank you so much. Thank you so much to the both of you for going into all the details. And so now I'm going to actually field some questions from the chat. So a lot of folks have questions about crisis response. I have one here, will 988 have to go back through 911 to deploy response teams, including law enforcement? So I know that we don't have a 911 dispatcher or somebody associated with 911 here. So we are limited in the scope of what we can say in terms of their protocols and their processes. But I think this question is more so about how 988 with 911. Like, people want to know, what is the process to deploy response teams back if it's deemed a public safety emergency?
Yeah. So our trained counsellors will do everything possible to help de-escalate an individual, or to ensure that they're looking at the least invasive intervention, right? So the intervention that is meeting the person where they are at and keeping them safe. In the very rare circumstances where we're not able to do that with the individual on the call, where perhaps there is an emergency or an imminent risk, or perhaps there is a suicidal act in progress and we're talking about life-saving intervention that needs to occur, in those instances, we will try and remain engaged with the individual, but may need to escalate that case to 911. And where possible, we will do that with the consent of the individual as well. And we know that from the history of the Lifeline, it's actually less than 2% of calls that come into the Lifeline that ever get to the point where it needs to get to 911 intervention. And of those, more than half of those are collaborative or in consent with the individual who has reached out.
Good to know, because we all know that many of us are concerned, and the whole premise behind this is really to try to separate public safety calls from mental health emergency calls. And so I guess I will do a follow-up for Kelly. You know, you spoke a little bit about less than 2% of calls get transferred to police, and that a lot of this is a collaborative process, and that you try to do everything in your power to make sure that if something's deemed a public safety emergency or in need of 911 services, that is done in collaboration and consented with the parties on the call. But are there any instances, you know, where, could you just provide some examples as to when 911 might need to be involved, just so that we're clear on like what could be defined as a public safety emergencies?
Yeah. So as I said, 911 is considered like a last resort for us. We're trying to do everything that we can to avoid 911 responses. However, there may be certain situations in which we may need to do that. As I said, we will try and do it collaboratively where possible, but there may be circumstances that it's non-collaborative. And that could include situations where perhaps someone is talking with us and makes a disclosure that perhaps they have taken some medication in an attempt to overdose, and perhaps they lose consciousness during that conversation with us. So really the times that we're talking about getting to 911 are ones where we need life-saving interventions to step in, and the fear that without those interventions that there is likely to be a loss of life. You know, as I said, it's our last resort that we are aiming for. And I think one of the things that really is a significant difference, and where 988 and crisis lines like NYC Well can help, is that when you call 911, it's a very quick process, right? As Denise was saying before, it's about dispatching. That's the purpose of calling 911 there. When you're calling a crisis line, we have so much more time available. We have the ability to ask a lot more questions. We can sit with a person as they're processing kind of what's going on for them, or you know, talking through, and sometimes for the first time, about what is happening for them and trying to get that support. And so we really have a lot more time that we're able to work with, which allows us to be a lot more thoughtful and considerate in terms of what we are going to try and do, and where what intervention is best for that individual.
Thank you so much for that overview. I guess as a follow-up, and because I know that there are a lot of peer specialists on the call, we would like to know, I have it here. The peer specialists would like to know, you know, how are peers incorporated into the model? And are there ever times where there will be a peer support specialist that can respond?
I could speak to the mobile crisis services because we're in the process of making sure that there is an opportunity for peer specialists to be part of mobile crisis teams and our comprehensive psychiatric emergency program teams, and that includes mobile crisis or in their emergency rooms, or peer-led crisis residential programs and crisis stabilization centers. We work very closely with the Office of Consumer Affairs at OMH. We work really closely with the advocacy groups, and we're dedicated to helping expand the access for peers to be available to individuals who are in crisis. But that being said, it's a process, right? All of this is a process of expansion and availability. So we are dedicated to this, and we're dedicated to the expansion of these services, and we're in the process of doing that as well.
If I can start on to that one a little bit, Kimberly. So NYC Well is really proud of its peer support line. And whilst at the moment 988 doesn't integrate peers into the model, because NYC Well has a peer contingent and a very robust one at that, anyone calling into NYC Well directly has the option in the phone menu or the chat and text menu to identify that they want to speak to a peer support specialist or someone with their lived experience. And so they can get routed directly to a peer. If we're talking to someone on 988 and we identify that they might benefit from peer support, or they indicate that they would like to talk to a peer support specialist, we can also make that warm transfer across to our peers as part of the NYC Well program, so that we're able to make that connection for individuals.
Thank you. Thank you. That's good to know. So I have one question here that's, can you call 988 even if you aren't in crisis? And the answer is yes. We address this, like there are different scenarios. Kelly, would you like to just quickly reiterate maybe some of the scenarios where you could call 988 if you're not to the level of an emergent crisis?
Yeah, so I mentioned earlier that you didn't need to be in a suicidal crisis, or you didn't need to be experiencing suicidal thoughts or concerns, that it's much broader than that. So it can be mental health, it could be substance use, it can be any kind of situation where you're experiencing emotional distress. And we know there's lots of reasons why that might arise. Perhaps, I think the examples I used earlier were like financial concerns, relationship breakups. It might be loneliness, I think was one of the other ones we talked about. So it can be anything that's causing you emotional distress for which you need to access some support for.
And that can also head off a crisis. You know, it's preventative as well. So that's an opportunity for not having to get to a point where you need an emergency crisis service.
Definitely. Thank you so much. And then, so is 988 24/7? That's a question that has come up multiple times.
Yes, it is.
Quick answer. I love that. Quick and efficient. Yes, you guys, it's 24/7. Okay, we have a question about investment. So can you speak a bit as to how counselors, so those who are answering the hotline, how are they trained? And are there opportunities for clinicians here in the city to also train and volunteer their time and services?
I'm going to let Kelly take that because she is the expert in that. And anyone who wants to volunteer or work on a 988 crisis line is welcome.
Look, one of the things that I will mention that I tried to drop into the chat, but I'm not very good at multitasking, so I may not have done a great job. But SAMHSA has a page that links to all of the centres that are associated with 988. And through there, you can identify your state or your location and click through. That will take you to the website and the opportunities for jobs or volunteering that is currently open in that centre that is answering 988 contacts. So that's definitely one of the ways that people can help to contribute to the building out of this system during like what really is a pretty historical moment for us when it comes to crisis response.
Yes, and we'll make sure to actually include that SAMHSA link in our follow-up email, because I know there are actually a lot of clinicians here, and maybe we could expand bandwidth a little bit even within this, with this event alone, right? And so that actually transitions into another question that has been asked repeatedly, which is, I've heard there aren't enough people to answer calls throughout the country. How is it here in NYC, in New York City? I think that's a Kelly question.
So I will go first, but I also want to leave it open for Denise to offer anything that I might not cover here. Look, there has been a lot of media that has been happening. And I think part of that is because this has been such a long process as well. So we're talking 2020 that there was first discussions where it got passed and legislated, and now here we are midway through 2022 about to approach the transition weekend. So throughout that time, there have been different stages in terms of what funding has been released, what has been disseminated amongst funding, how centres have been able to staff. But historically, crisis centres have tended to be underfunded, and the National Suicide Prevention Lifeline has been underfunded. So I think the concerns that were raised have been very valid based on what the history has been. But we are definitely at this time now where this is the most attention that crisis lines have ever received. And with that has come significant investment and increasement in funding and such. In New York City, we have been really lucky in that we have had a large existing contact centre that has been the contact centre that NYC Well has run out of, that has experience in high capacity, that has been able to be really structured and thoughtful about the way that we are planning to increase capacity in terms of bringing on additional staff. We know what it takes to expand at a rate to respond to new services and increases and such. So we're feeling good in terms of where we are now, but this is a new number. This is a new thing that we don't have. Like, we have projections and we have forecasts for, but we don't know what those numbers will be. And we won't know that for a little while yet. So we're preparing as best as we can with the support of both the city and the state. But New York City has been in a really lucky situation that we had a lot of existing infrastructure, contact centre, experience and investment that we've been able to leverage in preparing for this.
That's so good to hear, especially as a New Yorker. Makes me feel a little bit more confident in being able to access services. So thank you so much, Kelly. Denise, I know you talked about the soft launch earlier. Is there anything you'd like to add to Kelly's comments?
Just to state that New York State is making a significant investment in the expansion of 988. So Governor Hochul included $35 million for the first year for the expansion of 988 growing to $60 million. So that's, that is a significant investment where there had been none. So there's a dedication to this. In addition, there's been some other federal funding that we've been able to use to help support the 988 crisis contact centers. So across the state, they've been recruiting, hiring, training to increase their ability to answer calls. So we're trying to, reassure people that the process of creating capacity has begun. We're not behind on this, that people are moving forward. And like Kelly said, we have to see what the volume is going to be like. We have to see how it's going to grow, and then continue to help support these contact centers in getting the staff that they need. Whether it's through SAMHSA connection to hiring or the contact centers themselves recruiting and hiring.
Thank you so much. So I have one about processes and logistics. So people are really concerned on the call if all these services are confidential. To what extent is it confidential if I, as a peer or a loved one, call in trying to access services through 988.
Sorry, Janice.
No, I was waiting for you. You're the expert in this one.
So services that are offered, and I want to be clear here about, like, we're talking NYC Well and 988, so we're talking about hotline services here, are confidential with some exceptions. And so I want to be clear around what those exceptions might be. If you are making a mobile crisis referral, we need information that identifies both you and the person that you're making the referral for. And we need to be able to share that with the mobile crisis team in order to be able to get a referral out and to be able to have the team respond. So there are situations like that where you can see that the need for information is very clear based on what type of service that you're requesting or trying to connect with. The other situations are where we are mandated to report in situations where there is a risk of harm to self or others that is considered to be imminent. And so that's very much consistent with a lot of mental health services. But outside of that, everything on the call is confidential. We're not talking about who is calling the hotline and such. We are making sure that folks hear recordings in terms of what the confidentiality is, including the fact that our calls are recorded for quality purposes. We want to make sure that our staff are doing a good job in handling the interactions that they're doing. And so when you call in, you'll hear some messaging around that. But yeah, it's those circumstances in which we're trying to make a connection to care, or those in which we're mandated.
Thank you so much. Denise, is there anything you'd like to add?
No, that was perfect. Thank you.
Awesome. And then we did get some calls that, some questions that say, when does 988 go into effect? Just so everybody knows, it goes into effect this Saturday. So this event is really timely because you can access it as soon as this July 16th in 2 days. So I just wanted to make sure we reiterate that so everybody knows. And so another question we have is, trying to find the way. Okay, here we go. How will you handle repeat callers to 988? Will they be sent to warm lines so 988 resources will be available for more serious situations? Or is there another mechanism? Like, do you take on those questions even though those calls, even though they're repeat calls?
Yeah, so all repeat callers will continue to receive a service. But what we want to do is we want to balance what is the needs of those individuals who are reaching out to us repeatedly and the capacity of the line. So the suggestion of like referrals to warm lines is a really great one. We're going to look for whatever it is that that individual is needing support for, and perhaps what's changed since they might have last reached out to us. We know that, I think everyone on this and this session, I'm sure I'm talking to people who are already very well familiar with this, but we know that people's state fluctuates. We know that you might have called at a time when things were not perhaps as good as what you were hoping they would be, or that you were needing some support and distress. And we know that you might have periods where you don't need as much support. But if that fluctuates and you need the support again, you're more than welcome to reach out. What we want to check on with people though is, when you're reaching out frequently, what is it that you need to be able to help make you feel a little bit more supported and make you feel a little bit more stable? And we will try to connect you with those services. I think the one thing that we know is that there is lots of different reasons why people reach out multiple times. And we want to make sure that we're trying to match the best support and service with the reason why the person is reaching out multiple times.
Thank you so much. That is so informative. And then we have one, I think we have time for either one or two. We're going to try with one. So what are the credentials? We all spoke about mobile crisis teams before, but what are the credentials for the folks working on the mobile crisis team? Are they social workers, clinical psychologists, peers? And how many people usually respond in a team?
That's a good question, and I can answer it. It seems to, I mean, I haven't been reading the chats because I'm not great at multitasking with this either. It seems like we probably could have a follow-up conversation about mobile crisis, but you know, it is our expectation through the Office of Mental Health is that there's a multidisciplinary team for mobile crisis. So that it could include psychologists, social workers, mental health counselors, paraprofessionals, peers, and that usually it's a two-person team. So there's one licensed professional and then another staff, which could be any of that we discuss. So we like to see a multidisciplinary team, and we think that a two-person team is a good combination.
Thank you so much, Denise. And just so that folks are clear, Denise is talking about mobile crisis teams operated throughout the state, but there might be certain nuances with programs here in the city, such as Be Heard. We don't have a representative from Be Heard here today, so we can't really speak to that, but we're speaking from our experiences with mobile crisis teams across the board, across New York State. And so we only have 1 minute left. So unfortunately, the rest of the questions, we're going to try our best to make sure that we have follow-up resources available to you all. But I want to just say first, thank you to the both of you. You're so informative. I'm so happy to be on this panel with you, but also in the greater mental health field working and doing this work with you. So I just want to say thank you for your time. Thank you for your knowledge. I really do feel myself more comfortable today with my expanded knowledge of how 988 will work. And I hope the audience members on the call do as well. If anyone wants to get in touch with NYC Well, again, the number is 888 NYC Well. And also, if anybody wants any more information about OMH crisis services, you can go to the Office of Mental Health website, and there are resources on there as well. Is there anything else either of you would like to share with the audience members as we close off?
I would just like to thank all of you for having us today, for having me and Kelly. We love the opportunity to talk about this and make sure folks are getting accurate information and are more than willing to continue the conversation if needed.
Thank you so much, Denise. Kelly, anything?
Yeah, thank you for having us. Thank you for promoting this as well. And really excited to have everyone here who is participating in all our different forums today to be involved in what is going to be a really historical weekend this weekend. I think it's very exciting.
Thank you so much. Thank you both of you. Thank you to our Spanish interpreter, Andy Marquez. Thank you to China and John, our ASL interpreters, and everyone who made this event possible. We will have a recording up on our YouTube channel. So NAMI-NYC YouTube channel, you'll be able to access it within the next week. And we are going to try our best to make sure that we have a Spanish recording available as well. And if you need immediate to follow back, to just rewind back and replay any of this information, you can go to our NAMI-NYC Facebook, and the recording will be there. And for any resources that you'd like to access through NAMI-NYC, you can always access our helpline at 212-684-3264. Again, that's 212-684-3264, and I just included it in the chat. You can also email helpline@naminyc.org. Thank you, everyone, and I hope you have a great rest of your evening and that you feel informed by our presentation today. Thank you.